All right, let's get this thing kicked off. Well, hello, this is Jim Morgan with Caring Transitions, and this is our life's co-pilot. We do a couple times a month where we bring in an expert in senior services, senior cares, whatever goes along with that whole process. And today, Mona, who I work with personally in our own family, is going to be talking about something that I think that most families don't realize the importance of and what this service can do for you. Um, I know that myself, we had someone in this role for 9 years, taking care of my mom and my uncle, and which gave me the ability to do my job, okay, to do things other than take care of them. And she retired, and and my siblings who live out of state didn't think we needed another one. And that was the one time I put my foot down and go, no, absolutely we do, because I can't function without the help. And Mona came in to help me. So Mona, introduce yourself and what you do, and let's kind of talk about this kind of not well known services.
Sure, and I feel bad for you, Jim. Your throat, so it
Yeah,
must
I'm
be hard.
fighting it. So, you know.
Well, for everyone that does not know me, my name is Mona Euler, and I am a healthcare advocate. I can tell you a little bit about what I do, and there's a lot of different names for it. But basically, my background has always been in healthcare. Jim, I started out when I was 16 as a nurse's aide in a nursing home and then fell in love with the senior population. And then I've been blessed over the last 30 years to continue, get my bachelor's in nursing and move to the big city of Indianapolis, where I held numerous positions from director of nursing in a nursing home, director of case management to CEO of hospitals. And throughout that journey, I learned a lot about healthcare, whether it's the finances of healthcare, healthcare itself, and where's the most appropriate place for patients to go, and at what time should they do that. And then also a little bit about the support that they need, whether it's family support, whether it's emotional support. So that continuum is like a circle that you need all those pieces together to be able to navigate this confusing world of healthcare that we're in right now. And so that's a little bit about what I do. People always ask me, well, Mona, what is a healthcare advocate? And okay, so let's just do this scenario. You're trying to get somewhere important. And you know how we always use our ways and our maps, and it can take us to get us where we need to be. So we've got somewhere to go, and our maps doesn't work. Our our ways doesn't work, and we feel that panic. Well, sort of like what a healthcare advocate does. It gets you to the place that you need to go. It is that trusted, much like your app. It will go through all those winding turns that is healthcare that's constantly changing. And it's that trusted person that is holding your hand throughout that whole process. So that's a little bit about what a healthcare advocate is. It's really a trusted advisor.
Yeah, it's a situation where, we stumbled into it years ago by accident. Okay. So, well, I didn't even know there was people like you out there. Okay, it was kind of where this was, and we had my mom was dealing with stuff, and we ended up meeting this lady that was doing massages on the side at her assisted living, and that's how we met her. And she did this. What she called herself was a nurse advocate or a rent a daughter is what she used to call herself. Okay, um, and we were absolutely astounded with what she was able to do. She was she was a nurse, and so she was an advocate. And one thing I learned as a family member, a consumer, doctors and nurses at hospitals and places talked to her differently than they did us. They told her things they didn't tell us, and so we were able to lean into her to get information out. Now, in her relationship and I, she was very non-confrontational. She just was, very, very soft and very easy, very pliable. So my role was to be the bad cop. She was the good cop. Okay. So, if a lot of times in your role, that you get to be the bad cop. Okay, so but it's which is great. Uh, but I had no idea that these services were there, but they were a lifeline for me because I was dealing with my mom and my uncle. My siblings all live out of state, and I had this person that was riding herd over this. I call them like the quarterback. They're the ones that know what all the different players are supposed to be doing, and they're the one that's going to get on the case of that player over here that's not doing what they're supposed to do. And then they're giving me a report, so I know to me, I'm getting this bullet points as opposed to trying to keep all this crap in my head. So
Yeah.
that was my experience, and I lived for a long time terrified if she left. I didn't know there were others out there. Then I got into the industry and found out that there are. Your biggest challenge, I will say, with your industry is you guys all call yourself something different. There's
Mhm.
nurse advocates, there's
Yeah.
health advocates, there's geriatric care managers. We all do the same thing.
Yeah. Yeah. And it's interesting because people always say, well, why there's so many different names? Well, sometimes like a hospital case manager, that's only for in the hospital, right? They're the
Yeah.
case manager of that patient in the hospital. And then you've got a home care case manager. They're just doing the home care at home. And then you've got senior care coordinators, or like I am, a healthcare advocate. I do the whole continuum. I can do them from home to the hospital to back, but some people just do a certain section of it. So it can be a little confusing. I will say, over the last 5 years, it has got a little bit more coordinated. There's more, I think, visibility for what we do. You can Google now and people come up. The companies come up where they didn't before. The aging of America has really broadened the horizons for people such as myself, nurses, there are PTs that do this, social workers, to be able to follow and have enough clients for a full-time business, or if they want a part-time business. But you're right, there's senior care coordinators, aging life professional. I think the most important thing is not necessarily the name, but it's what do you need them for, right? Do you need them for just in the hospital? Do you just need them for the home care? Or do you need them to follow, much like your mom, follow them throughout their duration
Right.
and really look at the whole picture? It's interesting because you said, they go to the doctor's visits, they can interpret sometimes, Jim, these medical charts are 30 pages. And a doctor has 12 minutes,
Right.
right, on the average with a client. How is even the doctor, in their defense, they want to do a good job? How can they decipher 30 pages before you meet with them? And that's where a care manager comes in that already knows and has written down exactly what the issue is, what labs they want, what procedures they want. They tell the doctor the history. In my opinion, physicians and staff have been so thankful.
Mhm.
I've never had anyone be rude because I actually make their job easier, and we're all a team, and they make me feel like I'm part of the care team, not an imposter, but I'm that bridge with the family. You live here, but I have some clients that live in California or Florida, and I'm their lifeline with their loved one to explain what's going on with their clinical condition, to explain the doctor's visits and the doctor's notes. And it makes them feel like they have that lifeline because they can't be there and they don't understand it. Much like you said, some of the healthcare jargon, it's really confusing to know what's the main problem and what's the issue that we should be addressing right now.
Yeah, it's just we've found it many many times that extra person that's keeping track of it all, it's almost impossible to do on your own. So
Yeah. Yeah. And if you don't have a medical background, some of the stuff that they're throwing at you, you can't decipher what's the most important thing. When you're looking at all the diagnoses or the issues, you're like, okay, what should I be asking the doctor, or what should I be asking the facility? What kind of services do they need? And so it really does make a difference. And that's why we have that experience, right? To us, it becomes natural because we've been in these different surroundings. We know what to look for, we know what questions to ask the staff, and it just makes the care go so much smoother. We can't control what happens to a loved one from a medical standpoint, but we can make sure that they're getting the best care possible.
one of the things that I've found too is when they're dealing with so many different doctors, and a lot of times, later in life, that's pretty common. Keeping someone that's looking over the whole package,
Yes.
because a lot of times people will give misdiagnosis. Well, they'll be set on several goal tracks that are not necessarily complementary, and so it's nice to have someone that can decipher that and point out, wait a minute, this one's taking you this way, this one's taking you that way.
Yeah, it's interesting. Sometimes, Jim, at facilities, there are literally four different charting mechanisms. So you've got therapy charting in one, you've got the nurse or whatever physician group, you've got the facility, and then you may have a specialist in another one. No one there can take the time to look at it. It really needs a care manager that can decipher all those notes and make sure that no one misses something. I mean, seniors, Jim, it's not unusual for them to have 15 different meds a day, right? So if they go out to the hospital or if they have a change in condition, meds can be dropped accidentally. Meds can be doubled. Contraindications, they may not know they have an allergy. There's so many different things that can happen if you don't have that coordinated care and really have somebody that, as you said, you mentioned it before, quarterback.
Yeah.
It's that quarterback, right? We have a team, and I believe healthcare, just like raising children, healthcare takes a team. It really does. But you need that quarterback leading the team so that we can get everybody to the outcome that we need for that patient.
Well, it's just, with, I've been dealing with senior family members for years, and long before I knew about your type of services. And one of the things that happens, I think my mother-in-law, we found out that she had three different doctors prescribing her this very, very heavy duty antidepressant. So she was taking three times the doses of this. and we're like trying to get her off of it, but it's one of those things you have to wean off because of all the things that it does to you. And she had three, but no one knew this. Okay. And it was one of those like,
Yeah.
oh my God, you know, uh, my wife, my wife's grandmother, okay, on her dad's side, she had a situation come up where all of a sudden she wasn't making blood anymore. And so they'd have to go in and like top her off periodically, type thing. And no one could figure it out. The doctors in Fort Wayne, the doctors in Huntington could not figure out what was wrong with her. Well, I was talking to a doctor friend of mine that I worked for. He was doing a land development project. And I was helping him with that, and he was like, if you've ever seen the show House, he was kind of that guy.
Yeah.
No one got along with him, but he was really a nice guy once you got past all the crusty, bristly stuff, right?
Yeah.
Um, but he was this medical mind that you just did not. I mean, it's unfortunate he's no longer here. He was a pathologist, which was good because he didn't have to deal with patients, right? But I told him verbally about what was going on with her 100 miles away, fourth or fifth hand, right? And
Hmm.
he diagnosed it in like 3 minutes. He goes, "Go look in your medicine cabinet. If there's this drug, over a combination over a period of time, it shuts down the body's ability to make blood." He diagnosed it like literally that quickly. Well, we would never have figured that out, And if you have someone that's watching all this stuff that has medical help, that's something that's invaluable.
It is, and you mentioned you touched on something too, Jim. What we are facing now is, the silver tsunami. 11,000 people a day are turning 65. 1 out of 5 people in America is 65 and older, and it's going to go to 1 in 4. So huge percentage of growth in the senior population. So we've got the senior population, unprecedented growth. And then guess what? We have geriatricians actually decreasing. So geriatricians are those physicians, much like what you were talking about, that specialize in seniors and all their complications and all their meds and things that the side effects of their meds. So we've got a perfect storm of America getting older and less people going into geriatric medicine. That's where I come in. So right now in Indianapolis, it is not unusual to be waiting a year to get into a neurologist, to we be waiting 9 months to get into endocrinologist. What do people do when they need a specialist and they're sick and they can't wait for a year? That's where you really have to navigate the system. Is there an MP in that group that they can see? Is the primary care, can they take care of them? Is the primary care qualified to take care of geriatric patients? It's all those different factors that really affect the care that we're having to navigate, and it's not going away, Jim. I mean,
Yeah.
aging of America, life expectancy now, is 81 for a female and 75 for a male. It keeps going up because we're diagnosing things earlier, which is a blessing. Cancer is now a chronic disease. It's not necessarily a acute disease. So with that, we're using technology to diagnose and treat. However, there are issues with the aging that come along with people living the longest that they have as well. And one of that is the physician shortage, and how do we navigate that and still get the care that we need?
Yeah, there's I definitely see that as one of the challenges in trying to figure out how to fit all those people together. But um, one of the things that I think that people misunderstand is that how much the advocate is needed.
Hmm.
If it's a family advocate or whatever. But if you don't have the experience, you are going in basically taking a shot in the dark.
Yes. Yes. Many times people, when they say, well, what do you like? And I said, I am really like that family member that you love and trust that's medical. Well, not everybody has that, right? And then I know some families that they do have it, but they call me because they're like, Mona, I'm so overwhelmed. It's this sandwich generation, right? They may have the medical knowledge and, they're the child, but they're also taking care of children of their own, right? So they're working full time. They've got children and now they've got mom and dad. They can't handle it. They need that support. Many times it's just to call me and say, okay, am I on the right path? Do you have any other suggestions? But it is, you need that medical knowledge to be able to navigate, and
And
things
and there's something
change.
else beyond that. Even if you are that nurse in the family, you know,
Mhm.
what I have learned is I'm in the senior living world daily. That's all I do.
Yeah,
Getting my siblings to pay any attention to the fact that I might know something is
yeah,
next to impossible. Okay. So it's nice to have a third outside party that
yeah,
that might be able to break ties, put out information, and it's like, and I find that to be the case in a lot of situations, but it's like, and that we help families downsize. So we're
yeah,
dealing with that all the time. And it's just amazing how maybe I'll have a sibling or somebody in the family that actually gets what's going on, but they're
yeah.
always ostracized because everybody else is trying to make the decisions, and I'm kind of like, I'm looking at them going, hey, I live your world. I understand it, so, but
It's not unusual. This happens a lot to me, Jim. Like it's so true. Families will call me and say, Mona, you've got to come in because, we're all fighting about what's best for mom, or we're fighting about what's best for dad. So you've got three siblings and they all have a different idea of what's best, whether they can live alone, they need to go to assisted living, independent living. So I can come in, and many times I do, and I'm objective, right? I
right.
don't have I don't have a personal relationship. I just come in with my clinical eyes, understanding what's out there in healthcare, and I will sit with them and say, based on my assessment and your finances or your support, this is what I think. And it's almost like you can feel the tension leave the room because they're not they love mom or dad, but they're just really opinionated in what they think is best. But when I come in and say it, it's just like everybody's like, okay, she's looking at it from a different lens. She's not looking at it from a daughter or son's lens.
Right.
And so to me, that's one of the ways that an advocate can definitely help. I mean, there's nothing worse. This is my typical call. I will get a call because things change rapidly. I talk to people and they're like, oh, Mona, my mom is doing great. My mom and dad are doing great. They're doing great until they're not.
Yeah.
Until Mom has a stroke. She's in the hospital. And then the child is like, oh my goodness, I think my father has the beginning stages of dementia. And I never knew because my mom was compensating. So then you're in a really stressful situation where they were fine, right? Living independently. Well, now mom's going to have rehab and not sure she can go home. Not sure what we're going to do with dad because he can't be left alone. So Jim, things can change on a dime. They really can change. And then you're in crisis mode. And if you don't understand, how are we going to pay for the care? Should she go to acute rehab? Should she go to SNF? Should she go home and do outpatient? You just need a plan. You need a plan. And that makes everyone feel better. But if you don't know what you don't know, you're spending hours trying to Google it, trying to make sense of it. And it's still doesn't make any sense. It's much like I don't know accounting. I can't imagine, trying to do a complicated taxes because that's not my specialty. So
Right.
I always tell people, don't feel bad that you don't know this. You've not been involved in it. It's
Well, I
not part
was
of your
always
world.
like to explain people like with an elder law attorney, they're like worth their
Yeah.
weight in gold, right?
Yes.
And I didn't understand that until I used them, okay, for the first time.
Yeah. Yeah.
And what I run into people all the time, and I'm talking to them. I go, "Do you have an elder law attorney?" Well, we have an attorney. I go, "I didn't ask you that. I ask you if you have a specialist elder law attorney." And well, I have an estate attorney. I have this kind of attorney. I have that kind of. I'm going. The rules change every year. You need someone that's all they do, and they're focused on that. And the same thing in so many different areas of this senior health. We are not really lacking services and providers and programs. We're lacking the knowledge that they exist and how to access them.
Mm-hmm. Mm-hmm. And the coordination of care between all
Yeah,
of them.
right.
We're blessed in this area, Jim, to have really good elder law attorneys. I mean, just
Oh, we have some great ones. Yeah,
we have some great ones, and I think people are very lucky. But you touched on something. A lot of times they don't know that they need to get an elder law attorney involved with mom or dad until it's a little too late, and they're trying to do Medicaid planning, and there's just things could have been a little bit better if they would have thought ahead or maybe listened to a little bit of advice about looking at trust and different things that they can do.
well, I just sent you a someone to call you. I don't know if you heard it from her or not, but she's out of state. Her parents are
Mhm.
here. She's trying to deal with all that stuff. And she was, and we were talking about getting into some attorneys and stuff too. She was doing a lot of this on Chat GTP, and everything she learned was wrong. Okay,
Yeah.
and I'm like, please go talk to these people, because and I just talked to her last night. She was so excited. She had these meetings with these attorneys, and everything that she was terrified. She goes, I came in there terrified, and I walked out feeling very good about where we were because
Yes.
she understood where it was now. But what she was getting on the internet was garbage, you know,
Yeah.
and so which is not surprising to me, So it's like trying let's get you with people that really know and can get you from point A to point B in a safe and good way, So
And they know the state of Indiana. So,
mhm,
Medicaid is always changing, Medicare is always changing. You need people that are involved in that space that can tell you what the changes are or what the wait times are to be able to, access that care. I don't know how many people that I have talked to that still believe, Jim, that Medicare is going to pay for nursing home care.
right,
They don't realize that you have to pay privately after Medicare stops. And, I know people in Indianapolis that are paying for a nursing home, they're paying $500 a day for a nursing home bed. It's not unusual for assisted living in Hamilton County to be 6,000.
right.
It's not unusual for a memory care to be 8,500. Like these are big, big costs. And I hate to see people that work their whole life, and worked hard. I just want them to make the most of what their financial resources are and get the care that they need. Many times I tell people there's a little bridge period that you might be able to stay at home and have someone come in a couple hours a day, a couple times a week, and be able to bridge that period before you go to assisted living. Or you can try independent living. There's just that continuum of care, but you want to make sure you access it appropriately because sometimes people wait too long and then they're actually too sick to go to assisted living and they have to go to skilled.
Well,
Yeah.
that happens. That happens so often. It's like, my in-laws. We were trying to get them to move down. They were up in Wabash,
Yeah.
and we were trying to get them to move closer to us, where we could help support them and do things for them and whatever to probably be able to keep them living where they, independently longer. Okay,
Mhm.
but they wouldn't do that, and so they stayed up there. They stayed up there, and they're an hour and a half away. Okay, for us to get to them. There's not really a hospital there, just a triage center that sends them to Huntington or Fort Wayne or whatever.
Yeah.
And and you were talking about how things happen quickly.
Hmm.
We don't know if it was quickly or if it was just a change of circumstances. They were living there. My brother-in-law was living with them. Okay, because he was kind of needed to get his head on straight, so he'd moved in with them. Well,
Yeah.
they were just becoming this perfect little, unit that was doing all this stuff. Well, he died of an aneurysm. He got up one morning and just dropped, and 40 years old. Well, all of a sudden, the stress of that, okay. But on top of that, we started realizing how much he was doing,
Yeah.
and they were a mess, and we had to just, deal with it quickly.
Yeah. And you're talking about that, Jim. People don't realize how stressful caregiving is. It used to be that we had six caregivers for, every patient. Now we don't. We're at that crisis stage where there's not enough people to take care of our seniors as they're getting older. And caregiver burnout is a really big thing. You mentioned that you realized all the care that they needed. It's almost a full-time job. So if you have a full-time job and then say you have children, it is not, I've seen this many times. I've seen the caregivers have to go to the hospital. I've
Right.
seen them with illnesses. I've seen them with depression. And I'm always to them when I'm counseling, I'm like, you've got to get help. You cannot do this by yourself. You love them, but this will cause more issues in your own life.
Well, the Alzheimer's Association, in their Dementia Friends program, okay,
Mhm.
or SICO or whoever is doing the Dementia Friends, um, they say that 67% of the people who are the caregivers die before the person that they're caring for because of the 24/7, 365 stress.
And they feel isolated, Jim. So, especially with Alzheimer's, a lot of times they feel like they're trapped at home. So the caregiver doesn't have a support system because they don't feel like they can take their loved one out. And it's debilitating. It is just debilitating. I try to support them. I try to get them out to to feel human again so that they can be good caregivers because no one wants to be isolated. Isolation in the seniors drives so many health issues. It is really one of the biggest factors that we're dealing with now is isolation and depression.
Well, and
And
then that leads to the dementia. That's a
yes.
very much a cause of that, and then I guess hearing loss also does. So there's things that
And vision,
yeah.
hearing, a perfect storm, right?
Mhm.
That people aren't even aware of that they're having vision and hearing issues. It's really important that you need those geriatricians that are looking for all those things that could be causing, with dementia. Is it a vitamin deficiency? Are you going to a dementia specialist that will look and do a panel before they're doing their diagnosis and make sure there's not a medical reason for this confusion? Could be a med reaction. It could be mimicking another disease. It's really important.
UTI.
Yes, yes, which is so common in seniors and really affects their whole behavior. It's undiagnosed a lot of times or misdiagnosed. And so really having someone that is a specialist and, much like what I do, can be looking for those signs or symptoms or be able to say, hey, maybe we need a second opinion or let's do a complete panel. It's really important. And you mentioned dementia funds, support groups, right? It's crucial, even on Zoom, to have someone that you can talk to that is going through the same issues that you're going through, and you're not as isolated because you feel like you can talk to that person. It's really important.
So tell me, the scope of, because you guys call yourselves different things with your job.
Yeah.
Tell, just kind of make sure that everyone understands all the things that you guys do. So
Sure. So I help people that are adults. I don't do children. But I do help people that are facing a healthcare crisis. So many times it's seniors, and why it's seniors is because they need my services more. They are tend to need more services where younger people might need just a physician. Say that they get a cancer diagnosis. I get people that say, "Hey, Mona, what's the best specialist? Is there clinical trials that I could go to?" I get them on the right path, and then they take it from there. Where seniors come in, they have more conditions, more meds, more serious living issues. And so, what I do is any question related to healthcare or seniors, whether it's medical, legal, what meds they should be on, what physician they should take, what services, that's where a healthcare advocate can come in. If I don't, like I'm not a lawyer, if I don't do that particular thing, much like your services, related to services, I have my toolbox of people that can help them. And that's really what that quarterback does. If they can't take care of it personally, they have this wonderful toolbox of people that they trust, that they can say, okay, this person will do this person will do that. And it saves the client so much time and anxiety. Plus, they've been vetted, right? We know who we trust. We know who's going to take care of our clients. So for me, I do the whole gamut of healthcare advocate of any question that you have related to healthcare and aging, but it's primarily with the adult population. And so that's what a lot of us do is you wouldn't believe all the different things every day. It's something new, or it's a new regulation, or a new procedure, or just different things that we have to keep up on all the time because healthcare is constantly changing. Medicare is constantly changing. Costs are constantly changing. Facilities are constantly changing. So you really have to keep in that space.
yeah, it's just you're talking about your toolbox. It's the things that you're constantly pulling out. I'm literally handing out, not giving people names of people to contact about all different aspects of this because everyone has different needs. And so we're trying to figure out how to solve these people's problems. And so it's that's part of the whole process.
It's sort of funny because you start out in one thing and then they'll ask you, much like you get involved in stuff that you're like, okay, I was trying to do this, but now they're asking me about that. Well, that's the beauty of our business,
Right.
right? That it's not usually just that one narrow thing because people trust you. And so they're going to ask your opinion, Jim, just like me. They're like, well, Mona, who can help me with this? And I'm like, I've got somebody. So it just makes a huge difference.
Well, it's like talking about how this all flows. Right now, I'm getting ready. After this is over, I'm driving up to a client's new house that we just moved her to today. I met her a few months ago, and she's had a pretty tough year. Lost her husband unexpectedly and whatever. So when I'm sitting here meeting with her and her sons were in town, they're both living across the country. So we're meeting, and I walked away from that meeting going, there's nothing here that's even closely remotely ready to do anything. Okay. It's, you don't know where you're going to move to. You want to move. You need to find something that's easier to take care of, but you don't have any idea where that's going to be. Right.
Hmm.
So I go, let's do that first. Let's find you a new house. Okay. So we know what room you're going to have to move stuff from to. Right.
Hmm.
And so I got her hooked up with a realtor friend of mine. And he got there and he had to get her credit lined up. Then he was able to find her a place. And then her house has all kinds of issues that need repairs. And so he found an investor that will buy it as is so she doesn't have to worry about paying to get it cleaned out or what have you. And then we found a private investor that is buying a bunch of her stuff out of it to get her some cash. They had a double closing yesterday, sold the old house, bought the new house, and then we packed and moved. We packed her yesterday, we moved her today. We're unpacking her right now, and then we have the content investor coming in and buying stuff up tomorrow. So I mean, it's one of those things that none of that is really on our resume of the things. Well, the packing and moving is, but it's like you just kind of figure out how to piece together these puzzles to get someone where they need to be.
Well, you're solving a problem for them,
Yeah,
right? And so I always say, even if it's not something that I'm personally helping with them, it all comes back to you, right?
right.
You know that if you were in that situation, it would be so helpful if somebody said, "Hey, this is what you can do." So you can feel the sense of relief on them, and you know that it's going to come back to you, and in somehow, and then they're going to tell someone about you. I have had families where I literally have taken care of four members of their family. And I love it because it's the best referral I can get because they were happy with one and they're like, Mona, you did such a good job. Here's another one. And, I went one time to Seattle and flew back with a client that was really sick. And I flew back on the plane with them. And it was pretty touch and go there, but I had gotten that from a friend of a friend of someone that I went to church with. And you just never know, Jim, but it's the best feeling in the world that you're like, well, they must have been so happy with my services that that's just awesome. It is. So
And it's one of those things that you start developing your team around you, your toolbox or whatever you
yes.
want to call it, because you need these trusted resources to because they reflect on you as well. Obviously, even if,
Yes.
for instance, this just happened. I had a client that a senior living community representative contacted me and said, "Is there anything you can do for this person?" They were moving from Florida to Fishers. So I
Mhm.
get a hold of her. I talk to her on the phone. She's elderly. Her husband has some issues. So she was pretty much doing this on her own. And she needed to sell her house in Florida. She needed to pack up and move. She needed to get rid of all the contents, whatever. And this is in Florida. So it's a long ways from me. So she was telling me she was thinking about just selling her house to one of those services online, one of those, buy
Mhm.
your house, I think. I go, please don't do that. I go, you're going to get minimum dollars because they're just going to flip it.
Yeah. They don't know her. Yeah.
So I found a realtor down there that I trusted, and I got her and them connected. I got a carrying transition franchise down there to go take care of packing and moving her and getting all her stuff got. And her family was going to unpack her here, so I really had nothing involved in it at all. But I got the whole thing set up, But
Mhm.
it's still a very rewarding thing because these people need help, and if somebody doesn't step up, she was on her
Yes.
own.
And it's amazing, right? Because you start your day and then you'll get a call and you're like, okay, it's not really, in my scope, but I want to help them, right?
Right,
It's the right thing to do. And just like what you did, it comes back to you. It
right.
really will. And someone would recommend us, for something that they might have got a call that isn't in their scope. And they're like, oh, we're going to get hold of Mona and Jim to be able to take care of this. Take it to the finish line. That's what I
Right,
say. Take it to the
right.
finish line.
Well, what's it like working with you? Coming, now I know, so I'm not going to say anything, but it's like,
Yeah.
but if someone's wanting to get into this kind of services, what's it like? What's the process like?
Sure. So I do a free phone call, a 30-minute phone call, and it's just to find out, are we a good fit? Is it something that I can help them with, or is it someone that I need to refer them out to? And sometimes it goes for an hour because healthcare is never easy. And usually when they call me, they're stressed. And, they should be. I don't get them when they're healthy. I get them when there's something wrong. And so I really like to meet. So usually the client is the child, Jim. It really is. I have had a couple seniors, but it's usually the child that contacts me that's trying to help. And so I suggest meeting both them and the client so I can do a physical assessment. It's really important that I look at their environment, I look at their medications, do a more complete health history once we elect to be in, collaboration. So that visit, when I go out to see them, whether it's a nursing home, whether it's assisted living, or whether it's at home, usually takes about an hour and a half of a visit. And then I've got a game plan. And then we will meet again, either in person or by phone, and we'll come up with that action plan. And then we'll come up with how long do they want the services to be? Sometimes I can get people over their healthcare crisis and they do great. Maybe they were in a hospitalization, maybe they were misdiagnosed. We get them medically stable. They don't call me, or they might call me in a year when something else happens. I do have clients that I see every week, whether they're assisted living at home or in hospice. I do have those that I follow because the family wants me to follow them. And that's what's the beauty of my business is that you use me as you need me. So sometimes I can get them over the crisis, and I'll be honest, sometimes that is using hospice and they have a beautiful death. And, we make sure that it is beautiful and there's no pain. And then sometimes I get them over their crisis and they go back to where they were before. So it's all over the board. But the one thing that's constant is I'm flexible and I get to help everyone. I get to help them in one way or the other. So, but it's really important to do that meeting and that eyes on the client. It's really crucial.
Well, we obviously have you as a regular, and it's always nice to have the eyes on it because you'll notice things, or we've had a conversation before that you notice something that needs to be dealt with mom because you
Yeah.
saw it and it wasn't the same and things are different, so you need to feel with it. So those are valuable things to have available to us.
Yeah, it's amazing and I take it really personal because you know that person so well.
Mhm.
So you know if they're dehydrated, you know if something's off and it's those are the ones that are my favorite because you know them so well. You know their medical history, their social, their behavior. I feel like, that's a gift to be able to go in there and keep them medically stable. I do feel like a care manager can keep somebody living longer, Jim, and healthier. I
Right.
mean, by far than not having one involved.
Yeah. Well, I'm a big advocate, obviously, and so it is. I've learned the lesson by having someone before you, but it was like, and then you carrying the torch for me. So, um, and I think it's a service that people either don't know about or don't understand the value. And like for instance, my siblings had troubles understanding the value, and the reason being they don't do it.
No, yeah,
They're 1,000 miles away,
yeah,
so
they don't
they
see it.
yeah.
Hmm.
But I'm like, I know. I'm going to have help. That's just where it is. So,
Well, and another thing too that I feel like the value of a care manager is our job is to keep them healthy and out of the hospital.
right.
Because the hospital anymore can cause more problems because you have a different set of physicians that don't know the client. They're just trying to get over that, get him out of the hospital, right? Treat him with the one thing and get him out. Well, sometimes they can get a secondary infection in there. Sometimes their medications can get messed up. So it's not necessarily a great thing when they're out of their environment. We'd rather manage them in their environment and keep them out of the hospital. And that's what a care manager really tries to do. What can we do in their facility?
Well, one of the things too is that people don't realize, and when you get into the elderly, okay, and they're more fragile, there is a Ferris wheel or whatever you want to call it, merry-go-round, that if they fall off their horse, they fall off their little tightrope, and they end up going to the hospital. Well, then from a financial standpoint, you want to make sure if they're going to be in the hospital, that they're there for 3 nights, because then that pays
Mhm.
for the rehab.
Rehab. Hmm.
And every day in the hospital bed, they get weaker.
Hmm.
Okay, so I've heard it's 7 days
Hmm.
to recover from one night, type thing. So if they've been there 3 nights, that's 21 days before they're back on their feet again, really the way they were before they went in. And when you're barely hanging on in the assisted living type world, something like that knocks you off your pedestal. Then you do the rehab for a extended period of time to get strong enough to go back to your life. Well, that circle is, and so you get to where as soon as you know, once I go in there, this whole process starts again. Okay, because
Hmm.
it's not a, oh, I just went in and they checked you and they send you home and everything's fine. Normally, you're going to go through this whole cycle. And again, the more you can keep people out of that cycle, the better it is because it is a process.
It is a process, and the problem too is if somebody's I call them medically complex, right? It's that Ferris wheel, like they're on a tightrope and you
Right.
everything has to be perfect. And one little thing can throw them off. They get a cold.
Hmm.
Okay. They get a common cold and they don't drink for 2 days. Well, then that can land them, believe it or not, that can land them in the hospital. And as you said, it's 7 days, sometimes longer for every day that they're not in rehab. And what happens in the hospital is they may not get rehab even in the hospital until day 3 or 4. So we're
Right.
already starting, you know,
You're a month behind.
definitely a month behind. And, we don't recover as we get older. We do not recover as fast. And so
Mhm.
you're right. Our balance is off, the muscle mass is off. And so it is not unusual for a frequent flyer for one little thing to set off that they have to go into the rehab to get stronger. And it's just being able to manage that,
Right.
make sure that they are getting the exact number of days in a Medicare unit, or maybe they go to acute rehab and then they go to SNF. Then
Yeah.
they may go back to their assisted living, or they may go to home. And then people ask me, well, Mona, should they get home care PT or should they do outpatient? It really is up to the family and their availability. I mean,
Yeah.
going to outpatient 3 days a week is going to take more family resources than having a home PT
Right.
in. So, but you're right. It is with these complex, individuals with multiple diagnoses, multiple medications, one little thing can throw the whole Ferris wheel off.
Yeah. I'm saying like a cold which is right now I have one, so I'm not going
Yeah.
anywhere near mom
Yeah.
because that can start a whole
Yes.
mess
Yes.
of stuff,
Stay.
right?
Yeah.
Yeah. So
But then it's caregivers in the facilities or coming into the home that might have a cold, don't even realize they have a cold. And then seniors are just more apt to get something and then
right.
to get weaker as they age.
Yeah. Well, thank you for sharing with us. I really appreciate this. I'll put your email and contact information on the video so that people can find you.
I hope you feel better. I
It,
loved talking. I love being a healthcare advocate, and so it's just blessed to be able to do what I do.
all right. Thank you so much for sharing with us.
All right, have a great day.
Bye bye, Mona.